Hello, beloved. We're finishing up another year focusing on Black maternal health. If you got involved this year, thank you so much. We want to raise awareness because, as we know, Black women do not get all the care that we need and deserve when it comes to some medical professionals and even some establishments. And in order to combat the maternal mortality rate as it is in Georgia, in Florida, and across the United States, we need to make sure that our voices are heard. There have already been many programs that have been implemented to try to combat this and make these numbers look a little different. And although there's still a lot of work that needs to be done, awareness is key, and awareness really is on the forefront for you to know your rights, for you to understand what quality and good care is, and for you to start exercising that right. This past weekend, I had the privilege of hearing an obstetrician discuss the necessity of midwives and doulas and how we can work hand in hand with current medical care in order to give mothers the care and support that they need. Here's a little clip of that.
And as much as it's important for patients to advocate for themselves, it's just as important for us in the medical field to be advocates as well. And we've seen patients come up with creative ways and amazing ways to do this by utilizing their support systems, by utilizing midwives, by utilizing doulas, all of which are excellent supports. But we would be remiss in medicine not to utilize this as well. And so it's very important in addressing this crisis that we advocate for the patient to the patient. I see you, I know this problem, but I need to get to know you so that we can figure out how to address this together and to make sure that your voice is not lost in this big cloud of medicine and this big knowledge of medicine. Because while we know that in medicine there are so many gifts we've been given from the past, things that we can prevent now that couldn't be prevented before, how to manage preeclampsia in pregnancy, how to manage diabetes, how to prevent interactions in pregnancy with the use of RhoGAM shot or by treating GBS. We also know that despite that knowledge, we still have this crisis. And so we have to push ourselves to do a bit more by making sure that we advocate. And then it is so important as physicians, as community members for each other, that we take the best care of ourselves that we can, knowing that there are so many barriers. There's insurance, there's cost, there's transportation, there's children, there's work, there's always going to be a barrier that says, I could push this off, I could do this later. But if we remember to take those small moments to make sure that we're taking care of our mental health, our physical health, the conditions we know we have, how much more of an impact can we make when we meet together in the room? And so, during this Black Maternal Health Week, again, I want to come to you not in hopelessness, but in empowerment, that there is so much more to do and so much that we can do to address this crisis. And it begins by us working together, acknowledging the problem, acknowledging the history, and meeting each other where we are. Thank you guys so much.
So again, thank you for all your support and all your help, especially this month, to make sure that Black mothers' voices are heard. I'll see you back here next week.